Reconstructive surgery is an emerging and very challenging field that involves imagination, creativity, but it also at the same time is very technical. We nowadays use operating microscope and special microsurgical instruments, and we are able to transplant tissues from one area of the body to another and re-establish the blood supply. And by doing so we can recreate patients' body parts. For example, in the mainstay of breast reconstruction nowadays is the use of patients' own tissue to rebuild the breast, and the most sophisticated technique is called the DIEP flap. This technique utilizes fat and skin harvested from the abdomen with a specific blood supply, which is then transplanted onto the chest wall to recreate aesthetically pleasing breast.
Yeah, the first time I met Demir at the Christie Clinic was to talk about my breast reconstruction.
I recovered really quickly from the mastectomy. I was fine, I coped with that very well. But the one thing I had a lot of problem with was the lack of lymph nodes. And so I started experiencing swelling in my arm, a lot of heaviness in my arm, and I had to wear a compression bandage. And it got to a point where I was less bothered about having reconstruction surgery on my breast and more bothered about trying to find a solution for my arm.
We'd discussed about taking it from my tummy to make the breast, and then he'd noticed that I'd got some lymphedema in my arm. He'd picked up on that, I hadn't mentioned that to him, and Demir had then said that he could take lymph nodes from the top of my leg and then place them into the armpit to hopefully reduce the lymphedema, which I'd never even heard of before that.
When he said he could do that surgery, and he was really open. He said he has 100% success rate with the breast reconstruction, but less. But it's not 100% successful with the lymph node transfer, so I was prepared for that. But when he said he could do it, I come out of the hospital, I come out of Christie's, I was just over the moon, and that was the most important thing for me, that would work far more than the breast reconstruction in the end.
I think as a surgeon and a doctor, I have an obligation to inform my patients as well as public about the newest techniques and advances in the field of reconstructive surgery. My area of expertise is complex reconstruction following removal of skin cancers, including both melanoma and non-melanoma skin cancers. It allows us to improve patients' quality of life and restore what was removed or damaged by cancer surgery. In patients with lymphedema, we can significantly reduce the volume of their swollen upper or lower limb, and we can even prevent swelling from reoccurring. In patients requiring breast reconstruction, utilizing DIEP technique or similar types of microvascular free tissue transfers, we can achieve an aesthetically pleasing and natural looking breast. We are nowadays shifting focus from only cancer removal or, so to say, resectional cancer surgery into functional cancer surgery, where reconstructive techniques come into play and can definitely be valuable in restoring patients' function and aesthetics. For example, one of my patients, Peter, even though he underwent very extensive surgery for advanced melanoma, he just went back from skiing as his arm is fully functional.
What was great was, in a space of 24 hours, I was referred to Demir, and Demir was the first person to associate the first initial spot as a primary source. And so what was fantastic, again with a very rapid turnaround with Demir's initial review, we managed to correctly diagnose the primary source. He knew that the secondary source, where it was, and he predicted that it would be in my lymph nodes as well. So within a space of days, in terms of correct assessment, palpation and feedback, it was definitely malignant melanoma, and it was advanced
My area of expertise is complex microvascular breast reconstruction, as well as lymphedema surgery and microsurgery. Techniques that I use can help not only rebuild patient's breast following cancer treatment, but also help either prevent or treat swelling to their arms.
So when I first met Demir, and I was recommended to Demir by my physio. So my physio had said to me, she sees lots of reconstructions because she works with ladies who have lymphedema in their arm and who have, she works on the scar tissue when you've had your breast removed. And she said she sees lots of reconstructions, but the best one she's seen is Demir's. So not only did my breast surgeon recommend him, then my physio did as well. So that's how I was convinced he was the guy I needed to see. And when I actually met him, and he was so positive about what he could do, how he could recreate my breast, I had been told all the way along that because I had quite big breasts, I would have to have quite a big reduction on my other breast to give me any symmetry, and they wouldn't be able to make it as big. And he said he thought he could do it, but he would just do 2 flaps, and it's worked really well.
For me to meet Demir and to go ahead with the surgery, oh gosh, I just feel like a different person. I suppose for somebody having a mastectomy and then going ahead and having a reconstruction just made me feel like a lot more like a normal person again. And also the lymphedema, to get rid of that, for the swelling to go down, that's a big thing as well, because even though it wasn't really bad, it's still something else apart from you having the breast cancer and that side of it as well. So it was nice to have the surgery, and I've gone with the lymphedema as well as have a new breast.
The surgical techniques that I use to help patients with lymphedema include both targeted liposuction as well as free microvascular lymph node transplantation. These are quite sophisticated techniques that require dedicated training and many years of experience to achieve good outcomes.
I went to a drop-in at the breast clinic, and she said, oh, it's lymphedema. By this time I googled Demir, and I'd scheduled an appointment with him. I went to see him at the Christie privately, and he said, I'll tell you the truth. So I took my clothes off, he looked at my arm, he said it's lymphedema but it's gone to fat. The only way I can reduce the volume is by debulking liposuction. So I said, right, then I'm going to go for it. Went back to the lymphedema clinic, saw a nurse, and he said, oh, that's not so, that can't happen. I said, well, I disbelieve you, it's happening, and I'm going for the surgery.
The surgery for me, because I was in 2nd to 3rd stage of lymphedema, it wasn't about managing it now, because it had got so large and it was so heavy, and when you pressed it in, the dents stayed there. So it was to have liposuction to remove lymphedema. So I had to have the 3/4 of the thigh down to the ankle done to take out everything. And then last Friday I had the top bit done. A lot of people associate liposuction for vanity reasons, but it is a form of surgery that you can have done to remove lymphedema that is at the last stage, to start to remanage the lymphedema. Because originally, if we knew it was lymphedema, I could have tried to manage it, but no one knew that it was lymphedema, and the consultants at the mainstream hospital never told me it was lymphedema.
Many patients who may appear either too slim or inadequate candidates for the DIEP flap for any other reason, including previous surgeries, can nowadays benefit from modification of this technique, which is called double pedicle or conjoined DIEP flap. I have further modified this technique by including free lymph node transfer to tackle both breast reconstruction as well as lymphedema treatment in one single surgery.
So on the day of the surgery, it went smoothly. Like you feel like really well looked after. Everyone's always making sure you're okay. obviously nerves are kicking in a lot. And the surgery I got was a deep flap bilateral reconstruction, which basically he took the fat from my abdomen and transferred it up to my chest. And he did it in a way to kind of keep it as like natural looking as possible.
I want more people to know about what can be achieved and that their quality of life can still be maintained even though they went through horrific cancer surgery.
I think it's like so important for people to understand that there is this option, like to get surgery with a surgeon like Damir, who is going to understand your background and your story and not judge you on it, and kind of just be there to listen and understand.
He gives you his own email address, you have his own number, you don't have to go through the secretary, and he's there if you want to just have a chat about something. So I've spoke to him about the reconstruction of my the breast for alignment. I've spoke to him really openly about what else, you know, how he can do that to make it look even better, and he's so very, very approachable, and will give you a very direct answer. If he can't do something, you know he can't do it, and if he can do it, he will absolutely do his best to do it for you. And when you've been through a cancer treatment, that's really important, just to have that rapport and that relationship with your surgeon is fantastic.
Damir in particular is an expert in his field, and he's a reconstructive surgeon. So because of the complexity of what was needed, he was perfect to actually successfully do sort of 3 operations in one for me.
I think for the detransitioning community that it kind of gets hidden by the media and swept under the rug a lot. So you do feel like really alone in the process. You kind of feel like you're the only one going through it. But to have Damir there, not just as a surgeon, but he becomes almost like a friend really, because he's so supportive. So yeah, I just think it's so important to have this option here for people who are going through this. Yeah.
I feel great now, and I feel so much better, and I can't thank Damir enough. And I'm so much more knowledgeable with lymphedema, which I think it would give value to everyone else.